Regarding a trauma call, trimodal distribution of death. First peak comes in second to minutes. Death is because of apnea due to severe brain injury or spinal cord injury. Second peak comes in minute to hours. It's a golden hour. Rapid assessment and resuscitation is needed. And third peak days to weeks, sepsis and multi-organ failure. Basis of ATLS protocol is airway with control of cervical spine, breathing with oxygen, C is for circulation, hemorrhage control and IV fluids, pregnant movement placed in lateral decubitus position, crystalloids O negative type specific cross-matched blood should be given. Crystalloids have low osmolarity, fluid sucked to osmosis into soft tissues, cause interstitial edema, for example in the lungs. Tranexamic acid the crash two trials have shown that tranexamic acid loading dose 1 gram within 10 minutes and within 3 hours followed by 1 gram over 8 hours is effective. Disability, check the neurology and GCS. Log roll the patient, look for bruising and the feel for the step up. Exposure and secondary survey. Trauma series C-spine, chest and pelvic x-rays should be done. Cochrane, no evidence that resuscitation with colloids reduces risk of death compared to the resuscitation with crystalloids. In patient with trauma, burns, or falling surgeries, more than 1 liter of fluid. Platelets should be transfused within 1 hour to of leaving fridge. RBC and FFPs within 2 hours. Thromboelastograph allow accuracy of giving clotting functions, facilitate understanding of hemorrhage and thrombotic risk. Shock is a clinical manifestation of inadequate oxygen and tissue oxygenation. Septic shock is usually gram-negative, endotoxin bacteria, reduction in peripheral vascular resistance causing vasodilatation. Blood volume in child is 80 milliliter per kilogram, while in adult is 60 milligram 60 ml per kg. Hemorrhagic shock classification 10th edition ATLS. Class 1 is 15 degree, 15%, more than less than 750 ml of blood loss. Class 2 is 15-30%, 759 to 1500 ml blood loss. Class 3 is moderate, 30 to 40%, and class 4 is more than 40%.